Anastasia Turchetta, editor of Modern Hygienist, and you're here with us on Straight Talk, and our guest today is Dr. David Rice. He's taking time out of his day in East Amherst to share with us how in the world hygienists and dentists can keep our sanity through the holiday season. So welcome, Dr. Rice.
Hey, Anastasia, how are you?
I'm doing great, feeling a little festive today, as you can tell with the top, but I'm sure your whole practice is feeling festive. Give me 3 things that's been really successful for your practice that our audience, being dental hygienists, can take back and either use today or within the next 2 weeks for the holiday schedule and hygiene.
That's a great point, and it's something we face, year in and year out ever since I've been doing this. So I'll tell you, the number one thing for us is preparation. We all know in dentistry that this time of the year it's going to get a little crazy. So knowing that it's going to get crazy, what can you do ahead of time to get ready for it? So first thing for us, I think, is we alter our hours and we alter the folks who are going to be present on our team on a regular basis. So as you look at the next 2 weeks of your schedule, maybe as a team you can sit down and decide how to either expand hours or maybe just add additional team members who are part-time, give them an extra day or an extra 2 days. That helps a ton. Second thing I would say is great communication for us. Big fan. Morning huddles help. We all talk about who's coming in, where they're coming in, where opportunities may exist. If the schedule changes, because you know as a hygienist when you do clinical that for every patient who calls and wants to sneak in and make it happen, there might be somebody out there who calls and says, hey, I'm too busy, I can't come. But getting the whole team on board so when one call comes in, we can squeeze another patient in is really helpful too. And the third one I think I'd say is just attitude. We're real lucky. Our whole team's happy to do it. Everybody pitches in. And we get more flexible at this time of the year in order to accommodate people. So people are doing, they're expanding maybe what they bring to the team during these next 2 weeks.
Well, that's a lot, because I mean, to say that you're expanding what you can do with, within the hygiene schedule when you're already crunched can mean it can be stressful. So when you're talking about communication, let's go off of that. Does everybody know? Let's say we're posting our stuff, since June? So you buffer in time then? Is that what you're saying, just for communication?
I'd say yes. Step one for preparation for us is we know last June that December and January are going to be jam-packed. So we are intentionally scheduling our hygienists a little differently for about a 2.5-month time frame on the front end. And as far as communication now, because we're in it, it's all about, it's the 4 ladies who are up front answering the phone in constant communication with both the hygienists and our assistants to know as the schedule changes and evolves throughout the day, how we can pull somebody in when somebody else can't make it, or if there's an extra set of hands that can give one of our hygienists some help.
That's really helpful to know too. Now, all right, so I got to throw a zinger in there because this is going to sound great to plan, but right now we're in it. So for our viewers to say, you know what, Anastasia, you know what, Dr. Rice, that's all great, but how are we going to keep our sanity? How are we going to help our doctors keep their sanity during the next 2 to 3 weeks that we have to work now?
That's, I like your zinger. Thank you. I would say focus on the last 2 things that I mentioned. Great communication. Make sure everybody on your team is talking throughout the whole day, because I can promise you my office is no different than any other. There's room. It just may not, if a patient calls to cancel and Lori answers the phone, Katie might be answering the phone with somebody who wants to get in. So it's Lori and Katie getting together and having that conversation. So headsets are great if you have them in your office to make sure everybody's talking back and forth. But if not, just really, getting with one another throughout the day. And then the second piece of that is attitude and teamwork and being happy to do it and understanding that, hey, it's 2.5 weeks. We might work an extra hour today. We might not take a full hour for lunch, but we're helping our patients, we're helping the practice, and it'll be over with after the first of the year. We can take a little break.
I like your view on that, because so many of us do, and I myself, it's like if I don't get to eat something, you're just like, oh man, and then you think it's going to happen throughout the rest of the year. So to do something right now really does depend upon communication and attitude, and you're right. I mean, you can still add some hours on with some of those people who are calling in now, so that might be a nice way to do it. And you're absolutely right, I agree with you fully on communication and attitude, because there's always a way to make it happen for our patients, and that's really what it's about.
Very true. And I'll tell you, hygienists out there watching, don't be afraid to sit down and have a chit chat with your docs, because it's up to myself, it's up to my partners. We all have to pitch in and be a part of this team and lead by example. And I think that's what makes everybody here truly happy to help.
Exactly. Nobody needs a Grinch to come into the dental office, especially when we're there to help their smile and their health. So, hey, I want to thank you for taking time out of your busy schedule, speaking of keeping your sanity, and joining us here on Straight Talk. We look forward to discussing some more issues and coming up with solutions for everyday dental hygienists in clinical practice.
My pleasure. I'm going to go do an exam before I get beat up.
Awesome. Thank you.
You're welcome.